University of Arkansas, Fort Smith. We're going to talk this morning a little bit about how COVID-19 affected faculty who were already teaching existing online classes. Here is my email in case you want a copy of the slide. I can send it to you. A little bit about my background is I have been a nurse since 1982, so about 40 years. I have a master's in nursing and a doctorate in health science, and then I'm board certified in nursing professional development. Okay. So the objectives that we want to cover this morning is to identify the new challenges for faculty teaching online courses as a result of COVID-19. We want to assess the impact of COVID-19 on faculty teaching existing online courses and examine 3 coping strategies to reduce stress in online courses as a result of COVID-19. Okay, so a little bit of history. When you look at defining COVID-19, the CO stands for corona, VI stands for virus, and then D for disease. So what is COVID-19? Okay, and it's a novel coronavirus that was identified as a new type of virus disease which caused our outbreak in 2019. It had never been seen in humans before. It was seen in animals. In fact, I think the COVID-19 virus itself was found in bats. We saw a wide range of symptoms. So there were individuals who had no symptoms or minor symptoms like runny noses, or they had mild symptoms such as flu-like symptoms, chills, cough, fatigue, fever, body aches, nausea, vomiting, and many of those affected with COVID lost their sense for taste and smell. So then you had the more severe symptoms that were like shortness of breath, trouble breathing, confusion, and the worst case scenario was death, and we did see a lot of deaths with COVID-19. Okay, again, the history of COVID-19 in academia. Okay, so if you take yourself back to about 13 months ago, okay, Washington, maybe 14 months ago. Okay, so the first COVID case was diagnosed in January of 2020 in Washington, D.C. Okay. And if you look at just the timeline in February, that it was decided that, hey, this virus is serious. We have the infection that's spreading. People are dying, and so we got travel restrictions that were implemented by the CDC. And we hadn't yet met 3 of the criteria for determining that COVID-19 was a pandemic. So it met 2 of those criteria. So illness resulting in death and sustained person-to-person spread. And again, like I said, the worldwide spread had not been met yet. So in mid-March, COVID-19 then was declared a pandemic. Okay, you look, we had the state, each of our states who were mandating guidelines such as social distancing, no travel, PPE, mask, things like that to reduce the spread of COVID. Despite following the recommended guidelines, we still saw the cases, like I was monitoring those COVID cases, and you still saw the rise in the cases. And so what we did is how is this affecting the world of academia? Okay. And I mean, social distancing was a buzzword, it was a pretty hot topic among the faculty members. And we were just we've never been through something like this. Most healthcare providers have dealt with SARS or Ebola, but really had never experienced a pandemic. There was some research out there on pandemic, but most of us today have never experienced a pandemic. So the university senior leadership decided, with the numbers and deaths that are occurring, we're going to make the decision to close the campus. And the faculty were directed to transition classroom content to an online delivery format. And they were given about a 10-day turnaround period. So faculty prepared every single class that the university offered to be taught remotely. So all of that instructor-led curriculum had to be transitioned over to online format. This 10 days for us felt like a 3-month period, because I mean, it was just, now looking back, it was just like a whirlwind. And if you can imagine, students, they were dismissed for spring break. And then they were told, okay, after spring break, the campus, you won't come back to campus because it's closed. You're going to be accessing your classes online in a virtual environment. And so there were a lot of issues with students, barriers with students as well. Okay, so let's look at the impact of COVID-19 for online classes as far as the faculty, okay? Initially, for faculty who were already teaching online courses, the perception was, well, we're already teaching online, so it's probably not going to affect us that much. Students who were taking fully online courses their perception was that they probably really wouldn't, it wouldn't affect them, because they weren't coming to campus anyway. They were taking their education online, and so nothing should change for them. But we found out differently, okay? Faculty who were teaching existing online courses in March of 2020, when the pandemic was declared by the World Health Organization, were actually impacted by the virus itself. And we're going to discuss some of those challenges of teaching online identified by the faculty. So our faculty, we did just a small study here on the university, but our faculty, 68% of the faculty felt that they had an increase in workload. So even though their course or their teaching workload did not change, they weren't getting extra money, they felt that they had an increase in workload with the virus, because they were having to increase communication with the students. They were having to nurture. They spent a lot of time on the phone. They were doing a lot of hand holding. They felt like faculty felt like they had to spend more time preparing for classes. And so their course prep time increased as well. Okay, some of the other challenges to teaching online, faculty observed that they had to have a stronger, more rigid learning environment because students were, dealing with issues on their end, and we'll talk about the student impact. Faculty felt that they had to have a very good understanding of the LMS. So, those seated courses or face-to-face classes, um, it was a big learning transition for them because they didn't use the learning management system, and we used Blackboard. Uh, some of them didn't even use Blackboard at all. But for the faculty who at least were grading in Blackboard or submitting assignments in Blackboard, had some exposure to the LMS. Uh, they found out, the faculty who did not use the LMS, that it's really a benefit. And so it was just something that they were forced to learn in a short amount of time. But again, when you talk to them now, they're excited that they were able to learn some of the functionality in Blackboard that has. I mean, there's a lot of functionality in Blackboard. Other challenges to teaching online, we felt that the course had to offer a lot of engagement. So the remote classes that were being taught, in order to get the students engaged, they had to be on a webcam. But then you have when you mandate or require a student to be online and show their photo, it's almost like an invasion of privacy. So you have that fine line there. Faculty had to look at online and offline work and how it had to line up with the assignments, discussion questions, participation in courses, that sort of thing. We had a lot of faculty that had to adapt to diverse testing environments. So where faculty were used to maybe giving an exam in the classroom, they were having to look at alternative examity. But there were a lot of other different proctoring services out there. Again, you're looking at expense, and I know that some of our faculty in the smaller programs that we have, such as radiology, dental hygiene, they used Zoom, and that would faculty that would get in on the 16 students, and they would proctor the students themselves. But then we did adopt, again, we had Examity, so that worked real well for us. So let's talk about a little bit about the research that we did here on campus. Okay, we wanted to look at or focus on two questions. Faculty in higher education teaching online courses when the pandemic was declared, mid-March of 2020. And did the faculty in higher education who teach existing online classes do anything differently when they prepared for the following semester? So it was announced in the spring 2020 semester, and did they do anything to prepare for that fall 2020 semester? When we started looking at the literature, there was tons of literature regarding COVID-19 and the impact of students. but there was not a whole lot of information or studies done on faculty, and specifically faculty who were already teaching courses online. So we looked at faculty again, teaching online. Um, a lot of the common thread with that is that in the literature review reflected that faculty who teach online, they have to be well versed in technology, instructional design, they have to be a good communicator, and they have to be engaging online. Teaching face-to-face in higher education yielded its own challenges to those who now had to transition from that face-to-face to an online environment. Um, so let's look at some other information on that study itself. Okay, so the date of the study was December 2020, so that was about a semester and a half into the pandemic. The setting was a four-year university located in Arkansas-Oklahoma border. It's a medium-sized university with 5,000 to 7,000 student enrollment. It offers graduate programs, undergraduate programs, associate degrees. It also offers multiple certificate programs, LPN, EMTs, and training programs, welding and automotives, that sort of thing. Let's move and look at who the target audience was. So what we did was we polled full-time faculty, part-time faculty, adjunct faculty, counselors, librarians, and any other instructors who were teaching online when the pandemic was announced. Okay. We actually sent out 330 surveys, and we got 92 response rate, so that was good. The data collection tool that we used was the 25 question survey. We used that as our primary data collection tool. And then our secondary data collection tool was expert feedback. So the authors of this study actually taught existing online classes. So they were teaching online classes and have been for